Here is the tongue. This tongue has a root, body, and a tip. And this tongue has two surfaces. Here is the convex upper surface. This is known as the dorsum, and here is the inferior surface. And if we see the upper surface of the tongue, this is in this dorsum of the tongue, we can see this part is known as the root, this part is the body, and this is the tip. We can divide the tongue into three parts. This is the posterior most part of the tongue, this part, and this is the pharyngeal part of the tongue. The rough area is the pharyngeal part, and in front of this is the oral tongue. Here you can see there is a sulcus. This is a V-shaped sulcus, and it is the terminal part of the oral tongue. So this is known as the sulcus terminalis. In the center part of the sulcus terminalis there is a foramen. This is known as the foramen cecum. It has some developmental importance, and the origin of thyroid gland starts from this foramen cecum. And we see that the roughness of the anterior part of the tongue and the posterior part of the tongue is different. Here there is the lymphoid follicles, so this is known as the pharyngeal or lymphoid part of the tongue, and this is the oral or papillary part of the tongue. We can see here the small rough areas. This is known as the papilla. Here is the circumvallate papilla. Here is the foliate papilla. Here is the filiform and fungiform papilla. We can see this in a close-up view. This large one is the circumvallate or vallate papilla. Then this is the fungiform, this is the filiform, and in the border we can see there is the foliate papilla. In this papilla we can see there is the circumvallate papilla, there is the taste bud. And in the more closer view of the taste bud, we can see the sensory epithelium is modified to form this special sensory cell of the taste. Now we can see the muscles of the tongue. Here is the tongue. It has some intrinsic muscles within the tongue. These intrinsic muscles are the longitudinal muscles. There is the superior longitudinal and inferior longitudinal muscle. Some muscles are transverse, that is known as the transverse muscle, and some are vertical. These four pairs of muscle are the intrinsic muscles of the tongue, and some extrinsic muscles of the tongue. Some are from the superior part of the tongue and some are from the inferior part of the tongue. From the superior part we can see there is the palatal arch. From this palatal arch there is a muscle. The muscles that are related with the tongue all are known as the glossal. So it is from the palate to the tongue. This is known as the palatoglossus. Here is the styloid process. From here there is a muscle that comes to the tongue. This is known as the styloglossus. And this part of the image is known as the hyoid bone. From the hyoid bone there is a quadrangular muscle that moves upward to form the tongue. This is known as the hyoglossus. And here is a genial tubercle of the mandible. From the genial tubercle there is a muscle, fan-shaped muscle, that forms the tongue. This is known as the genioglossus. So we have the four sets of extrinsic, two from inside genioglossus and hyoglossus, and two from inferior side and two from superior side. That is the palatoglossus and the styloglossus. These muscles have the nerve supply, and the tongue has some sensory supply. For the nerve supply to this muscle, there is a cranial nerve, the 12th cranial nerve, that is known as the hypoglossal nerve. So all these muscles are supplied by the hypoglossal. Hypoglossal means here we can see there is a nerve that is underneath the tongue. So it is known as the hypoglossal. This is the hypoglossal nerve. This is the 12th cranial nerve. This nerve supplies the motor part of the whole of the tongue except the palatoglossus. Here is the palatoglossus. This palatoglossus is supplied by the pharyngeal plexus. Here is the pharynx, and this pharyngeal plexus is formed by the cranial accessory and the glossopharyngeal nerve. So cranial accessory or the pharyngeal plexus supplies the palatoglossus muscle. All other muscles, both intrinsic and extrinsic muscles of the tongue, is supplied by the 12th cranial nerve. This is the motor supply of the tongue. Here we can see there is an image. Here it is described that this tongue has the three parts. The posterior most part, this is the pharyngeal part, and this is the oral part. All the muscles of the tongue is supplied by the hypoglossal nerve except the palatoglossus. And the sensory supply from the tongue is divided into the general sensation. That means all type of the touch, pain, pressure, vibration, these are the general sensation. This general sensation of the tongue has different nerves. In the anterior part of the tongue, the general sensation is carried by the lingual nerve. Here in this image we have seen there is a nerve, that is the lingual nerve. This is the branch of the mandibular nerve. This lingual nerve carries the general sensation of the anterior part of the tongue. General sensation from the posterior part of the tongue is carried by the glossopharyngeal nerve, and this part by the vagus nerve. So general sensation of the three part of the tongue is carried by three different nerves. Here is the here is the general sensation is the lingual nerve, here is the glossopharyngeal nerve, and here is the vagus nerve. And the special sense, that is the taste sense, it is also carried by the same nerve in this posterior most part by the vagus, here from the glossopharyngeal nerve, and the anterior part, the special sense, that means taste sensation, is carried by the chorda tympani nerve. It is the branch of the facial nerve. So the nerve supply is very important, and you have to memorize all the parts of the nerve from the motor to the sensory, general sensory, and the special sensory nerve. Now the blood supply of the tongue. Here we see there is a branch from the external carotid artery. This branch is known as the lingual artery. This lingual artery supplies the tongue, and a speciality of this lingual artery, it is a tortuous artery. Here we can see that there is some part of the artery is tortuous, and the venous drainage of the tongue. Here we see some vena comitans along with the facial artery, along with the lingual artery, and along with the along with the hypoglossal nerve. These are the vena comitants. All these vena comitants finally forms the lingual vein below the hypoglossal nerve, and finally drains in the internal jugular vein. And the lymphatic drainage of the tongue, from the tip of the tongue, the lymphatics moves to the submental, and this is bilateral drainage. From this part, they goes to this part, from this part to this part, and along from the this part they also goes to this part. So there is a bilateral lymphatic drainage to the submental lymph node from the tip of the tongue, and side of the tongue they goes to the submandibular lymph nodes. These are the anatomical features of the tongue.